My name is Kendra Nielsen-Miles. I am the Executive Director and Founder of EDS Wellness, and I'm here with Dr. Linda Bluestein, who's starting her new practice, Integrative Pain Management Practice in Wisconsin, and we're here to talk about it a little and learn about it with her. So Dr. Bluestein, thank you for being here, and please introduce yourself and tell us a little bit more about your new practice.
Great. Well, thank you so much, Kendra, for giving me this opportunity to share with you what it is that I'm doing. I'm really excited to share with you the opening of Wisconsin Integrative Pain Specialists. And we are going to be taking care of people who have complex pain problems. And these patients are, whether it's or mobility spectrum disorder or fibromyalgia or some other condition that causes persistent pain. Patients that have those problems have a lot of effects on their whole life, and so using an integrative approach can be very, very helpful. And I'm really excited to be able to share this with you, and I'm excited to be able to serve this group of patients who are in very, very much need of help. And I've been doing a lot of educational things for the past couple of years. And I opened the clinic because I had so many patients coming up to me after presentations or approaching me in other ways and asking me for help. And without actually having a patient encounter, it's really hard to be able to help very much. And so I'm excited to be able to actually, see someone do a thorough evaluation, be able to do a complete history and physical, and be able to actually, give them individual advice and not just more global information and more general information. So I'm really excited to be able to help people.
Well, as a patient that has, 15 million different chronic pain conditions, all probably linked to EDS, but, they're all pathological and there's different types of chronic pain. And I think that's what's so important, is that to have a provider that is willing to help us, but also understands not only the underlying condition, but that we really do deal with many different types of pain from several different causes, and that chronic pain itself isn't just one lump condition. It's
Right.
a lot of times a cause for many different conditions. And as a person that has it and has EDS or has other things, I deal with different types of pain every single day. And I think that's also very hard for a lot of people in general, my family, whether it's your friends and even other providers, to really understand. It's almost mind-boggling. It kind of goes against the way that our healthcare system is set up to help somebody. And when you deal with it for so long, there is the long-term effect of dealing with chronic pain. It does affect the way the brain is rewired. Thankfully, research has shown that we can improve that. But it also really, you learn to deal with it, but it doesn't mean that it's easy. And it doesn't mean that we don't deserve help or that we just have to learn to just suck it up and deal with it. I mean, I think there's a part of that we learn to because we want to live, but we also need help and appropriate resources and integrative resources. So speaking of the patients that you were talking about, can you tell me a little bit more about the patients you expect to see in your practice, or whether you're just solely focused on Wisconsin, or will you see people outside of Wisconsin?
I can see people from anywhere. So long as they come to see me for an initial visit in Wisconsin, I can see anyone from anywhere. And I will do my very best to follow up with people with telephone visits, or, I would try to, if someone's coming from a distance, I will do everything I can to minimize their need to travel. So I'm happy to follow up with people, in that type of manner. So, and the people that I think I can probably help the most are people that have really been experiencing, like you said, multiple, like people who have Ehlers-Danlos syndromes can have all three types of pain. They can have nociceptive pain, which is pain from actual tissue damage, usually related to microtrauma, subluxations, dislocations, little tendinopathies, which are not so little, can produce a lot of pain. They can have neuropathic pain, which is related to damage in the nerves themselves. And then they can also have centrally mediated pain, which is the changes that occur in the nervous system after someone has been in pain for a while. And so patients that have Ehlers-Danlos syndromes and related disorders can actually have all three types of pain, and they can have pain coming from all different parts of their body. in addition to the 3 types, they can have many different locations. And that can make it really challenging when they go to a doctor who only has 10 minutes to see them, and the patient starts to describe, I have pain here, I have pain here, I have pain here. It's really hard for both the patient and the doctor to really get that addressed in an appropriate manner. So I think the people who will benefit the most are people who really need that longer visit in order to really delve deeply into not just the different parts of their body that are having pain, but the other effects that, chronic pain affects your sleep, it affects your appetite, it affects your ability to enjoy life, it affects your ability to do your job and function as a member of your family. So I'm excited to be able to help people look at all of those facets, whether it be nutrition, like I said, their sleep, all of these different things that chronic pain does impact their life. So it's a time-consuming process to really look at that whole picture, but that's really what my goal is with people, is to really look at their whole entire scope of their existence and how this has been impacted, and help them get their life back. That's really my goal, is to help people get their life back.
Their function, for sure.
Right, and function better. Right.
Yeah, right, exactly. Well, I can't thank you enough for being here and for giving us a little bit insight into your new practice and what you plan to do. Before we leave and before we just end this, will you give us a little bit of an insight, if briefly, into there's a whole big buzzword on integrative. I talk about integrative. I think some people are very scared of the word integrative. They think all of a sudden this means that they're going to be sold a snake oil or something. As a traditionally trained medical provider, will you please explain what integrative medicine means and how you expect to use integrative medicine into your practice?
Right. So integrative medicine is basically an approach that involves both traditional training and traditional techniques. As you mentioned, I went to medical school at UCLA and I trained at the Mayo Clinic. So I have traditional training, but I also have a lot of training and education in integrative approaches as well. So that uses also, complementary medicine. So looking at the benefits of various different supplements and things like nutrition and exercise and again, sleep and things like that. And I'm very fortunate to have Ms. Jennifer Varga, who has a master's in nutrition, on my staff. And she is a consultant who is brilliant in using foods to help us feel better. And I think a lot of us forget that everything that we put into our bodies has the ability to impact how we feel, and everything in our environment actually has the ability to impact how we feel. So people that have, for example, mast cell activation disorder, we need to really evaluate what is in their environment that could be perhaps contributing to their symptoms. So I'm excited to have Jennifer on board also as a consultant, and she's also available to consult with people on an individual basis. I consult with her all the time. But she also will be able to consult with patients individually. And so we're going to use all of those various different modalities. I'm open to everything. Every consideration for treatment, I look at the risk and the benefit. And with a lot of these things, the risk is relatively low. If the risk is low and there is potential benefit, then why not try it? If the risk is significant, then it's a different story. Then you need to have more evidence that there is a potential benefit. So, but in terms of dietary things, there's so many things that can be done. So I plan to work with people on, the whole picture. It's very important to address the psychological factors, movement and exercise, and again, to get people functioning better.
Well, thank you very much for explaining that. I think that's very important that people understand that integrative medicine or integrative approaches really look at the whole person, not just this specialty that you are. It's more of just taking all the multi-system approach, if you will, and looking and using complementary approaches such as physical therapy, lifestyle medicine, nutrition, different things like that. In addition to medications, it's not all or nothing. It's really an integrative approach. Integrative in terms of looking at the whole person and every system that's affected, but also using these different modalities that we now have a lot of research for. And it's not really all or nothing. It's really just an integrative approach that really helps take care of the whole person. Correct. And I'm very much in favor of using things,
I mean, sometimes there are interventional things that we need to do, but a lot of the things that we can do are not invasive. And so, you know, there's, especially with people that have Ehlers-Danlos syndromes, we need to be very, you know, very mindful of what we do to our bodies, because, you know, we don't necessarily react the way that other people do. So
we're a little sensitive.
Right.
We're a little sensitive. I think it's also important to realize that there's not one magic pill, and that sometimes finding the best recipe that works for me or for you, you know, for somebody else or for one of your patients is all going to be different, and that it takes time. There's no fixes, and that I think we've learned that, and the research is really proving that, and that what matters is that we have a provider, and providers are a team that really helps us along our journey finding the best recipe, and that works for us. And what works for us 2 weeks ago might not work in a month. So it's a matter of having somebody in support behind us that helps us. So thank you for being one of them.
You're very welcome. And thank you for the opportunity to fill people in on what it is that I'm doing. And I'm excited and can't wait to help as many people as I can.
Well, great. Well, thank you again. And we look forward to hearing more about your practice as you open.
Great.